Hello, my name is Jacqui Fletcher. I'm the clinical lead for pressure ulcers for NHS England and the National Wound Care Strategy. We're here today to talk to you about our approach to stop the pressure for 2022. This year, our focus is on risk assessment and risk assessment as a call to action in preventing pressure ulcers. We are primarily focusing on Purpose T as the risk assessment tool of choice, as it is evidence-based, but we are aware that in some countries people use other risk assessment tools. There's a wealth of literature to support the use of Purpose T, and that's why we've selected it for use. And across the Stop the Pressure Day activities, there'll be a whole host of activities around the use of Purpose T and other things to help you have fun and be educational in helping prevent pressure ulcers. We're working together with the Society of Tissue Viability and the National Wound Care Strategy to ensure that we have a coordinated approach across all of the 4 nations. Although in NHS England, we will be recommending the use of Purpose T when we put our recommendations out later this year, early into 2023, this is something that's new for us. So I want to hand over to Christina Harris from Wales, who's going to talk to you about what it's been like for them in Wales as they implemented this some time ago. Thanks, Christina.
Thank you, Jacqui. All health boards in Wales have rolled out Purpose T, and we've been using it for some years now, and it's been implemented in both primary and secondary care, with the exception of paediatrics. The All Wales Tissue Viability Nurse Forum was approached by the digital health team to recommend a single evidence-based standardised risk assessment tool for pressure damage as part of All Wales digitalisation of nursing documentation. After much research, the group chose Purpose T as the risk assessment with the most robust evidence base. It's generally been well received, with only a few teething problems. And one example of the teething problems was that some nurses, particularly in the vascular and podiatry side, felt that their cohort of patients wasn't represented in the tool. However, when we delved into this a little bit deeper, it seemed that it was just a small tweak in the language, and because the word circulation wasn't used, they felt that their patients weren't represented. However, when we discussed this and they realised that perfusion, it was just the language change for circulation, and that was sorted out quite easily. A more recent finding that we've had in our face-to-face training sessions are those nurses who've not been exposed to Purpose T in their training, or some agency nurses are not familiar with the tool, and it can look quite daunting when you've never seen it before. So we've just put some targeted training in for those individuals. As tissue viability nurses, we feel that Purpose T is an intuitive tool that allows us to use our clinical judgment and steers us away from ritualistic care, and actually gives you a full sort of guidance towards the treatment pathways that we need to use for pressure damage. It didn't come quite as easy as we thought it was going to in the beginning, and it was challenging to implement it, because as nurses we know we don't like change. So it did take some time to embed in nursing practice, mainly because Waterloo has been around for so long. So we are planning a large-scale audit to measure its true value, and unfortunately this was delayed because of the COVID pandemic, so hopefully we'll be able to do this early next year.
Thanks, Christina, that's really helpful. If I can pass over now to Jeannie to tell us what's happening in Northern Ireland.
Thank you, Jacqui. In 2020, the Tissue Viability Nurse Leads, which represent all of our health and social care trusts, undertook an evaluation of the Purpose T. And the reason for this was that we didn't feel that our current tool accurately identified key risk factors for our patients, the key examples being perfusion, which Christina has already spoken to, and also things like vulnerable skin. It seems, madness that we had a tool that didn't actually identify people who already had pressure damage. So we carried out an audit, looking at how our current tool scored our patients and how the Purpose T would score the patients. And what we found was that the Purpose T accurately identified patients in 100% of cases that were at risk of pressure damage, whereas our previous tool was only picking up about 70% of people who we felt were at risk. So following this, we obviously had the pandemic, which slowed down, our implementation of the tool. But we're now in a position where we're going to launch Purpose T between November and January, with the hope that mid-January the tool will be introduced into all of our trusts. And also we are working with our educational providers, both in the universities and post qualified education services, to ensure that the Purpose T is integrated into all of our training, whether that is face-to-face or e-learning. So we're excited about moving forward with our journey with Purpose T.
Thanks, Jeannie. And a really important point there that both you and Christina made about engaging students and making sure they're coming through knowing about Purpose T. But as I said, not everybody is using Purpose T, so we are going to get some words from Connie Traynor from Scotland, where at the moment they're not using Purpose T, because I think it's important that the focus is on risk assessment, whichever tool you use. So Connie, could you tell us what's happening in Scotland, please?
Thank you, Jacqui. My name is Connie Traynor. I'm a tissue viability nurse in the independent sector at Ross Hall Hospital in Glasgow. This year, the Four Nations campaign is sending out a strong message for November Stop the Pressure. And although the emphasis is on Purpose T, the focus is very much on risk assessment for the prevention of pressure ulcers. In Scotland, with the exception of the Shetland Isles, Purpose T is not used. However, we look forward to seeing, hearing and reading of its introduction and implementation in other areas of the country. Irrespective of the environment we work in, a risk assessment that reminds us to recognise, respond, report and reassess will benefit all our patients. Thank you.
Thank you, everybody. That's been really useful to have the roundup of risk assessment and what's happening in this Four Nations approach to our Stop the Pressure Day for 2022.